Good evening, everybody. I'm Dr. Gigi Elbayumi, founding director of the Rodham Institute, as well as professor of medicine at George Washington University School of Medicine and Health Sciences. Welcome to House Calls with Dr. Gigi. And I have a very special guest this evening, Mr. Adrian Williams. Hi, Adrian.
Hi,
How are
how
you?
are you? Good to see you.
Good. It's good. It's always great to see you. We've got a very special program today on sickle cell, which is something that people have, and yet there is a lot that the public doesn't know. And actually, sadly, a lot of doctors don't know how to take care of people with sickle cell disease. And actually, how the healthcare system interacts with people who have sickle cell disease. The vast majority in the United States are of African descent, but we'll get into that too. Actually makes their symptoms worse, and actually we don't serve as a healthcare system Black people very well, but we really don't serve people who are have the sickle cell disease very well. So we're going to go ahead and just get started, jump into it, because Mr. Adrian Williams is not only an advocate, an activist, a health activist, and really educator. He's also a patient. So let's just start off by getting to know you, Mr. Williams, Mr. Adrian. Tell us a little bit about yourself.
Well, I'm a native Washingtonian. I grew up in the Washington, D.C. area, and I grew up at a time where practically nothing was known about sickle cell disease. When I was diagnosed as a child around 5 years old, it was just a complete mystery to my family and a complete mystery to most physicians, and getting care and treatment back then was literally impossible. I spent the better part of experiencing those painful pain events at home, taking aspirin and over-the-counter medications, which did very little to assuage my pain or anything like that.
So where was the
And
pain? You said you started at 5. How did it manifest? Share with
it
us what it
manifests itself
might
in
look
my joints, in my back, and my legs, and my sort of elbows and shoulders. I mean, it was just an insidious sort of experience as a young child, trying to navigate that without the assistance of the healthcare system. I mean, if it were not for, and I write this a lot in my blog, if it were not for, the 1963 passage, the 1967 passage of Medicare, Medicaid, I probably would not have been here. That passage alone probably saved my life, and the wherewithal of my aunt and uncle who raised me, getting me to George Washington University Hospital, along with the passage of that bill, is the reason I stand here today, because that provided my family, who was lower middle class at that time, access to health care for a child. They were
Mhm.
raising my parents, my aunt and uncle were grandparents age by the time they sort of adopted me. So, they were well beyond navigating. They were both had maybe less than high school education. So
Mhm.
that sort of passage, and someone informing my mother about that process, really sort of saved my life, because it pulled me into the healthcare system when I
Mhm.
otherwise would have just experienced these painful events at home.
Mhm.
And as you know, the physician, you can't really endure these painful symptoms at home. It's just way too much to bear for a child, much less an adult.
I want to come back to that. First of all, it was 1965, the same year that the Civil Rights Bill was passed. So,
Yes.
by former, well, President, long gone now, Lyndon Johnson, whose
Lyndon Johnson.
114th birthday was just a few weeks ago. So, yeah, that was part of the landmark legislation that passed to allow for Medicare and Medicaid. That's what sort of created it. So, is it an ironic that now the forces are there to get rid of voting rights as well as Medicare, Medicaid? But
Yeah,
that's another whole
that's
show
another
secret,
discussion.
right? But just I mean, I can't imagine as a child, 5 years of age, and I imagine that this would have impacted your ability to play, to go to school, to I mean, how I mean, you were 5 at the time, but what
Right.
did your family tell you about your behavior?
Well, it really forced my family to sort of come to terms with having a sick child when they didn't otherwise have to. And it
Mm,
forced me as a young child really sort of have to sort of become an introspective child. When I couldn't do physical things outdoors, I had to become introspective and figure out a pathway to survive this thing until I began to understand it.
Mhm.
So that was quite a daunting thing for a 5, 7-year-old to figure out how do you
Mhm.
endure this thing and how do you make the most of what's left of this life.
Mhm.
When you're given that sort of sentence, and people didn't expect children to live that long with this sort of diagnosis. So in my mind, you grow up really fast and you try to figure out what I'm going to do with the time I have. And, I
Mhm.
became this really super introspective child. I read a lot. I've read ferociously, and it helped me escape sort of my reality at times. And it helped
Mhm.
me deal with a lot of the pain events at times as well. And it's helped me to this day to just sort of create a mind that can sort of process complexity and really sort of navigate this healthcare system today.
Mhm.
That's all started when the 7-year-old.
And I thank you. And I see that our co-host, Mr. Ellis Dean, is with us. So glad. I know that you're wrapping up another show, and we're just getting started, Mr. Ellis. We're just hearing from our special guest, Mr. Adrian Williams. He was just telling us about the journey, his journey with sickle cell.
Yeah.
So we're going to be hearing from him sort of as the cornerstone. But I think it would be important to kind of back up and talk about what is sickle cell disease, because
Right.
not everybody might know exactly what it is. As I was saying at the top of the hour, basically, it is something that predominantly impacts people of African descent here in the United States, but other people from other parts of the world can get it because race is a construct, right? So, what happens is that because of one amino acid that's missing, just one, the red blood cells, which are round, when they are exposed to particular stress, and we'll talk about what that is, they become like sickles, like crescents. And so they can't move normally through the blood vessels. And you can imagine blood is an essential, so it's the vital, fluid that goes through, it's the life giving energy that passes through our bodies. And so you can imagine that a child who has that, when they have a sickle cell crisis, which is, we're going to talk and ask you more about that, but this is a disease that can impact almost every single organ system, right? And we'll go through that in a minute, but most people will talk about the pain crises that
Yep.
they get. So we were just hearing from Mr. Adrian about what that felt like. I mean, as a child, right? 5 years of age, that must have been something. But I know that Mr. Ellis, you want to welcome everybody to the show. I didn't do the wonderful introduction that you usually do. So
Well,
I'll pass it to you.
I just want to thank everybody for joining us, including especially our guest, Mr. Adrian Williams, who is a fantastic advocate, speaker, writer, just because he can speak to it from personal experience, and then he can speak to it about, he took his personal experience and shared it, and not a lot of people do that. And so I want to take this brief moment to thank him for doing that and being an advocate for those people that are suffering with that are living with, I won't say suffering, that's such a negative
Living.
term, that are living with sickle cell disease.
Mhm.
But also I want to welcome everybody that's watching us here live on blackdoctor.org. You're watching House Call with Dr. Gigi. And so September is Sickle Cell Awareness Month. And I think a lot of times in the national discourse doesn't get a lot of attention, right? Because of that fact that we know what it is. It's like it impacts more people of African descent. And so it doesn't really hit mainstream America as hard. And so when it doesn't hit them as hard, we don't get a lot about it. But we know in our community, sickle cell is significant. I believe at last count, there's about 100,000 or so people living in the United States with sickle cell diseases. And as we go through the discussion tonight, I think there has been, and Adrian, you can correct me if I'm wrong on this, there has been an overemphasis on pain crisis and not as much emphasis on the other complications that can come from living with sickle cell disease. And so we're going to talk about some of those things tonight. And some of them are preventable, some of them aren't, and some of them require the people that are watching this program that aren't living with sickle cell to roll up their sleeves and get involved. And so we're going to talk about that as well. So thank you all for joining us. If you have any questions, if you know somebody, please drop those in the comment section. Also, if we're going to drop some resources available, everything Adrian's going to drop the blog, any resources we have available to you, because we want this to be a living program, not just for this hour tonight, but living beyond this hour, to where you can get the information and resources that you need to get the support, because it's a family. You have to have a support system to live effectively with sickle cell.
And I should say, please share this program with anybody that may be part of your care team, whether it's doctors or nurses or others, because our education, medical school or whatever healthcare profession, is sorely lacking in the area of sickle cell. So this is something, because the other thing about this particular show, we're not just treating a disease, we are treating a human being who lives with a health condition, right? So that's what I think is so important. So going back to you, Mr. Adrian, so kind of take us through. So what this diagnosis did for you is that it made you be an incredible reader, and reading became your refuge.
My
So you
refuge.
couldn't participate in as many sports as you otherwise would have liked to. So take us through. So what sort of has the medical journey and also sort of emotional and mental health journey been like for you?
Yeah, it was quite a journey. I mean, when you're young and dealing with this, you're sort of grappling with the reality that this might not be a long journey. So you're trying to grapple with, so what do I do with the time I do have? How do I make that? How do I make it matter? The relationships I'm creating, how do I make them significant? So you do that until you're around, 7, 8, 12, and you get that sort of I'm still here kind of mentality, and maybe there's an outside chance I can survive this, and maybe there's an outside chance I can reach adulthood. Right about the time I was turning into a teenager, the George Washington University Hospital created an infusion center where they would treat people who were given chemotherapy, but they would also treat people who were suffering from a pain crisis, sickle cell disease. And the wonderful thing about the infusion center is it gave me sort of perspective, because you're locked into your own bubble when you have your own disease and your own battles, but when you're shoulder to shoulder with someone who's receiving chemotherapy, it really sort of put everything in perspective. It just made me see the world differently and see the universe differently. Like, I'm not the only one who's suffering from anything. Here's someone who's 40 and undergoing chemotherapy, and I'm here with a crisis who may get up and walk and return back to school in a few days. So it really opened again my paradigm and my view of the world and my view of possibilities. And that's about the time I started talking to therapists about, the weight of this, the psychological, the emotional trauma, the traumatic experiences this thing leaves behind, because this is such a disruptive disease. So one minute you're well and you're talking about going to the prom and you're talking about buying your first car and getting your driver's license and going to see the Wizards play basketball and all this normal stuff. And then, maybe a week later, that all gets canceled and all gets changed. It all gets postponed, and you're in bed or you're in a hospital bed. And dealing with that up and down, crisis is really just a gut-wrenching sort of journey for any young adult to deal with. And so I sought the advice of a therapist. I'm like, this is a really difficult thing. How do I emotionally survive this thing, and how do I come on the other end of this not so emotionally scarred? So that alone really just helped me put together a mindset where I started to unpack all these traumatic experiences, unpack seeing myself as different, and then understanding with therapy that everyone is different. Everyone has a challenge. You were shoulder to shoulder a couple of weeks ago with someone who was undergoing chemotherapy.
Mm-hmm.
And that just really opened up my window and go, I'm not the only one who's suffering from anything. There's a lot of people out here doing this. And maybe I can, maybe I can do this a little bit better with a little more effort and a little more understanding, and if I put together a great support system, which I began to do that with my aunt and uncle and cousins and siblings, and just my own understanding. Because as a young adult, like most young adults, we're sort of lost in denial. So I don't want anyone to know I'm different. I don't want anyone to know why I missed school. I want to be just like everyone else. And then when you sort of began to embrace your differences, because we all have them, it sort of liberates you. And I became liberated. I would just tell people I have sickle cell disease. And it's like, Did I just say that? Wow. I've never told anyone that before. And it was so liberating, you know, and I would tell my employers, I would tell my educators, I would tell my neighbors. And I no longer had this dark secret to carry around. And that was the first step of my wellness journey, was just living and embracing and being myself and saying,
which is a very hard thing to
yes,
do, especially as a child, because you're right. This is an illness that really starts in childhood. And every kid wants to be able to go out and play and so forth. So I want to just talk a little bit about some of the health impacts that children have, because what happens with sickle cell disease is that it can affect the spleen, and the spleen is an organ that not only clears red blood cells after they've lived for 120, 130 days, but also is responsible for our immunity. And so children in the first several years of their life actually who have sickle cell have to be put on antibiotics, and they absolutely have to get immunized against a whole host of bacterial infections because they are at risk. Infection is a huge issue for them, but sadly also strokes, skin ulcers. But the thing that I learned really in preparing for the show, I'm not a pediatrician, I did not know about this, that when kids who have sickle cell have strokes, it doesn't affect their motor function, so you won't see them limping. It affects their cognitive function more. Absolutely. And so that's why really going to a center where you have people that know what they're doing and can really aggressively take care of kids so that they can continue to be in school and be the best that they can be, becomes so important. And even before that, before a mom gets pregnant, to even know, does she have sickle cell trait? Does the father of her child have sickle cell trait? Does that increase the possibilities of having a baby with sickle cell? Because there are different things that you would do if you're a pregnant mom with sickle cell, or even if you have the trait.
Yeah, I think, and if I could pick up just a little bit on that, I think one of the things outside of, I'm going to speak to what people that don't have sickle cell disease can do, because I learned this last year, just recently, and on this journey of learning about sickle cell disease, is that people that live with sickle cell disease need a lot of blood transfusions. And because it's primarily, especially in the States, in the African-American community, we need African-Americans to donate blood, right? And yes, blood is blood. We understand all that. But again, there are subtle differences in the ethnic groups. And so it's finding that we did a partnership with the American Red Cross and really got some information and really talked about the need for having Black blood donors, particularly for sickle cell patients. So Adrian, can you speak to more about that? I just know about had that surface knowledge.
Oh, absolutely. I mean, there comes a time in every sickle cell patient like where you're faced with the need for a transfusion, and without African-American participation in that transfusion process, donors, we're waiting and waiting and waiting, and sometimes we go without. So that may prolong that crisis. There would have been maybe 3 to 5 days until sometimes 2 weeks, because they weren't able to get that transfusion. So we really got to participate in this transfusion process and get African Americans really out there donating blood and participating in that process. It's so critically important. And it's important that they learn about sickle cell disease as well as participating in donation of blood. Right. It's really critical.
So tell us a little bit more, because, blood transfusions, we just think of it maybe when somebody's had surgery or somebody's been in, God forbid, a car accident. But why would a person with sickle cell disease need a blood transfusion?
Well, I think the levels get so critically low, in that process.
The hemoglobin, right?
The hemoglobin levels get so low. Then infusion would get it back up to a normal state, and so they can survive that crisis and return to their normal lives quicker. Without that, you have to wait till the body recovers and regenerates itself, which could be a 2-week process, if not even longer. So that would just shorten that whole crisis period return them back to full health and return them back to their lives. So that's why that transfusion is so important. Because I was talking to a patient today, and her fetal hemoglobin was a 1.
Oh my God.
So that's so deadly low. So
Give some context about what it should be.
And the context.
So normal should be between 12 and 15. Young women, when they're getting their periods, and if they're having very heavy periods, may drop down to 9. One is quite low.
Critical.
And so people, the normal functions of the body cannot happen. Like you can't think, you can't get the blood to the heart, to the kidneys, to the liver. So all these things then add up so that you can have strokes, you can have heart disease. Sometimes when the sickled red blood cells, those crescents, clog the blood vessels to the lungs, there's something called chest syndrome, where you can't breathe and you're just in severe pain. So I want to come back to pain, where, of course, we can't measure pain. We only go by what somebody tells us about pain. So as an African-American man who has had to go to the emergency department, I would imagine, a few times in your life, I know that you manage your sickle cell disease very well. We'll come back to that. Tell us about how you get treated when you get to the emergency department. What are the different experiences that you've had?
Well, ideally, and I've had experiences that run the gamut. I've had experiences where I've gone to an emergency room. I've been seen pretty quickly. I've been given pain medicine. I've been given oxygen and IV fluids. And I've literally have left the emergency room at 6, 7 a.m. and gone to work. Best case scenario, where I walk into the emergency room, I get into a bed, I tell them my symptoms. My wife was with me, or someone who understands sickle cell disease say, I know exactly what to do. I got it. Or even just opens up and asks me, hey, I haven't seen a lot of sickle cell patients. Can you guide me through this? I want to do the best I can for you, and I want to return you back to your life. What's normally done for you? What's worked and what hasn't worked? And I say, usually I get some IV fluids. I usually get a couple of milligrams of morphine to resolve my pain. I get some oxygen. If I'm given that quickly, I can return to my life pretty quickly. Worst case scenario is I get to an emergency room and the debate starts. We're debating where my pain is. We're debating the source of my pain. We're debating what I need to test. I need blood tests to make sure your levels are what you say they are. What are your normal levels? And that this whole argument and this whole back and forth begins. And now I'm lobbying.
Are you drug seeking?
Now I'm lobbying for the care I should rightfully deserve as a U.S. citizen. I'm lobbying. And that's the last thing a sickle cell patient wants to do, is be sort of this advocate for their care in the midst of a crisis. We don't have the energy or the time or the resolve to do that in that situation. And then on top of that, we're sometimes and oftentimes accused of just being drug seekers.
Yep.
So you're faking the crisis because you need morphine. You're faking the crisis because you really want to get high on Dilaudid. You're faking the crisis. And despite how well dressed you are, how articulate you are, what kind of car you drive up in, what your wife looks like, they have such a mindset about, I've seen sicklers before, I know what they do, and you're stereotyped instantly. So my experiences has run the gamut. And when I've had those worst experiences where people accusing me of being a drug seeker, I experienced my worst crisis ever. And I spent 3 weeks in the hospital because it just started wrong and stayed wrong. And on the other side of the scenario, I've been in there literally 3 hours and returned to work.
Wow. Well, I want to just share with our audience, we had a very powerful panel where Mr. Adrian was one of the guests about sickle cell. We had an NIH researcher, we had the head of an advocacy organization, which we'll mention in a second, and Mr. Adrian, and these were all doctors or doctors in training. And he leaned forward and told the audience, when I come into the emergency department, you treat me like crap. I'm writhing in pain and you're asking me all these questions. Last I checked, none of you are drug or pain medication specialists, that, you are just questioning me at a time when I'm just having severe pain. And as part of that panel, we had shared actually 2 abstracts that I just want to mention with you right now. One is 86% of people who are in the midst of a very painful crisis choose not to go to the emergency department and stay at home because of how they get treated in the emergency department. Second study is because of how poorly we, the healthcare system, treats people with sickle cell. Guess what? Their pain actually increases. So, what do you say to that? How do you begin to? I mean, you're an educator, you're an advocate. What would you wish the people that are caring for you, if God forbid you go into whatever setting you're going into? We won't say
there's two messages. I mean, I speak to patients with a certain message, and I speak to providers with a certain message. And the provider message is, you have no magic ability to identify a drug addict. You just don't. There's no magic wand. There's no drug test. There's no urine test for you to identify a drug addict from a non-drug addict. So the best way forward, the best practice is to treat everyone with dignity and respect when you see them. You know, and if that person is a drug addict, this is not the setting to resolve that. So treat the person as they present, and you can resolve that later with the social worker. But you're not even trained to diagnose what a drug addict looks like and how he manifests himself or presents himself. So this is not even the right setting to do that. So we should just remove that from the complete scenario. That's not a part of this process. This emergency room, this emergency department isn't even designed to diagnose drug addiction. It's just not. So for that to be a part of this exchange, it's a useful and it's fruitful. What my message for patients is, you know what you may or may not encounter in an emergency room, but it's critically important that you go and get care you need. You know, it's also critically important that you build these relationships with emergency physicians. You don't go to Howard one day and GW one day and Georgetown one day and Sylvia another day. You sit there and you build a relationship, and you visit these emergency departments when you're well. You have this primary care physician and your specialist, because these relationships are critical to your health. A lot of us are just removing ourselves from the healthcare system because it doesn't serve us well. That doesn't serve you well when you do that.
Right.
This is something you cannot avoid. So create these wonderful, healthy relationships with everyone involved with it, and don't remove yourself from it.
Ms. Yvonne just actually posted that having your internist or primary care doctor call the emergency department on your behalf, so that you're not in that situation, which speaks to what you were saying, which is having those relationships. But the issue, though, now that's becoming real is that there aren't a lot of internists or primary care doctors, right? That's a real issue. And, it becomes just more and more difficult to navigate. So how have you kept yourself out of the emergency department?
Well, that horrible treatment, that horrible experience I had when I was accused of being drug seeking, and my crisis just got out of hand. I was in the hospital for 3 weeks, really sort of inspired me to wellness. It said, I really want to avoid this intersection at all costs. And what can I do to do that? I need to be a better steward of my own personal health. That experience just really inspired me to go, I don't want any part of this, which is horrible to say, but it really inspired me to go, I need to take better care of myself. I need to rest. I need to sleep. I need to eat in a manner that preserves my wellness. And that started me on that journey where I just changed every possible thing in my life. I changed how I ate. I changed how I thought. I went to a therapist regularly and worked on my emotional and spiritual health. I removed toxic people from my inner circle. And I just was dedicated to just being a healthier, sounder, stronger person, physically and spiritually and emotionally. My emotional health was a critical element into changing everything for my health. Becoming a strong emotional person was just the key to everything. Emotional intelligence is the key.
That's a lot. And I think that's true for anybody facing anything, really, certainly a chronic illness, but that is so inspirational. I want you to talk about some of the support groups that you've participated, or organizations that you're participated in, and even some of the people, because I would imagine that one of the very challenging things that you face when you have a chronic illness, when you form friendships with other people that have them, sometimes you lose those people. And how do you cope with that? Because I want to acknowledge a few people that we both know that have passed.
Yeah, that's the hardest part, is to see people on this journey and they lose their battle with this thing, despite all their very best efforts. And I want to circle back to a little thing of what I said about emotional intelligence. This disease, and I was talking to a patient today, this disease will scar you and fill you with traumatic experiences. It's filled with stops and starts. So I never want to discount the difficulty of pursuing this wellness journey. I know it's difficult. I'm not going to sit here and say it's not. It's filled with just traumatic experiences on top of one another. And I'm beginning to sort of formulate a new language about pain events. I call them chronic pain events now instead of crisis. Because what I call the crisis is when you are unable, because some of the situations in your life, to manage a crisis, but to manage a pain event, it becomes a crisis.
Mm-hmm.
It becomes the fact that you've lost a week of work. It becomes the fact that your mother is home from a week of work and taking care of you, that you may have lost that job, that you may have missed a semester, you may have missed the final exam. That becomes the crisis. So it takes so much for us as patients to really put together a life that's so well organized, that you have such a tightly packed support circle where when you are sick, you have certain things in place. Like, I built this relationship with my primary physician. I built this relationship with my neighbor. I built this relationship with my educator or my employer, where when I am sick, they go, "Oh, we talked about this before. I understand. Go get well, take care of yourself, and I'll see you when you return." So it takes so much. And every time I do one of these things, I never want to discount the difficulties that patients face. I know it's rough with just more and more and more traumatic experiences. So I don't want to discount my path to wellness. It was a big journey, and it would continue to be a difficult journey.
Mm-hmm.
Well, I think you made a great point earlier when you talked about that freeing moment of actually just saying, "I have sickle cell," right? Because that is probably that biggest hurdle that people have to get over, because it's the stigma, and you don't want to hide it, and you're used to hiding and pulling back. That to say that out loud is the first biggest step. And then, okay, you say that out loud, and now you've got to build your team, right? Because the parents, if you had parents and support system, but now you've got to build that team. Primary care physician, you mentioned relationship specialists, now you've got that regular therapist to give you that mental health checkup, making sure that you're eating right. So there's a team of people that are helping you stay, maintain, and every patient has to build that team. Having that binder with, the discharge reports from hospitals can save you a lot of time and a lot of arguments, right? Just putting it 3-ring binder. And so when you walk in the door, hand it to them and say, "I'm not drug seeking.
Right.
This is what I received before."
Right.
And so now, now they can pick up, minus the few that have bias beyond bias, but they can say, "Oh, they can read through that, get a summary, and pick up." So now you don't have that fight, which will increase your aggravation, can make your adrenaline level spike, because now you're aggravated that you're having this fight. And then that could exacerbate the crisis that you're having right now. In that moment.
And I talk about a lot in one of my writings. I talk about, being prepared for the crisis. A lot of us are so apprehensive about going to the emergency room. We wait 2 days into a crisis to finally go to the emergency room, where now your pain level is such a high rate, very little they can do for you, except give you a little bit of pain medicine and wait it out, because it's just sort of, there's like a cap on your pain. So once it reaches 9, whatever, nothing is really going to affect your pain. But if you went into that emergency room at a 6 and say, "I'm at the beginning levels of a sickle cell crisis pain. My pain is a 6 now, but it feels like it's going to escalate beyond this. I figure this is the best and safest place for me to be. Let's start this treatment plan now." So that you present a calmer, more palatable patient to an emergency room, as opposed to, "I've been sick since last Tuesday. My pain is at 12. I'm screaming at everybody in the emergency room." So, we have to learn how to manage this thing too, despite the racism elements in the system.
Right.
Well, it's sad to me that we have to have all of these things in our mind when we should just be focusing on our
Our
health.
wellness.
But I do want to make a point that one thing about pain and how pain is mediated is that it is much better to get pain at the beginning, to your point, than to let it go on, because there's a different set of fibers that get activated in chronic pain. I think they're the C fibers. And once those fibers get activated, to your point, it's very difficult. It's like the cat's out of the bag. You know, if you
Yes.
can keep it here, that's one thing, but once it's out, and so there
Yes.
becomes memory of the pain that stays. So I think that is based not just in your experience in science, and it does help make it sadly easier for the healthcare team to make it
Yes.
more palatable for them, although that to
Yes.
me is not the primary goal of all of this,
Right.
but rather that you get the best care possible. Now, I can tell you that patients who have sickle cell are not always offered the treatments that have been proven to work.
Mm.
Hydroxyurea, which is a very old drug, has been around for at least 50 years, often doesn't get offered. Can you tell us, Adrian, of other treatments that people, we're not suggesting that we're not in any way advocating a particular treatment, but
Right.
what's out there that people might not know about?
There's several other treatments out there that aren't being presented to patients because I think patients aren't really creating these, and it's not the patient's fault, but physicians aren't creating these healthy relationships where they're having this ongoing dialogue. I have a physician who works out at Georgetown University Hospital, and we're always having this ongoing dialogue about what's coming down the road. Are you willing to try this? It seems to be super effective, but she's presenting this to me mostly because she's created this relationship with me.
Mm-hmm.
You know, I go see her regularly. She's created, so she's really reached out. I'm beyond patient X. I'm Adrian, someone who she cares about and she's known for years. And she's talking to me, and I understand, trust, and listen to her. So she's really gone out of her way to create a relationship with me. If other physicians were doing the same thing with their sickle cell patients, they would be more likely to come and see them regularly, and will be
Mm-hmm.
likely to trust them when they suggest new medicines that are coming
Mm-hmm.
down the road in terms of
Mm-hmm.
treatments and therapeutics. But I just don't think those relationships are being created, and then as a result, people are staying away.
I
So,
want
so
to
Dr.
just
Gigi, yeah, I just got, yeah. So this, there's one thing I want to give a shout out to Yvonne, who's watching via YouTube, and she brings up a great point. So that person, when you're presenting, and most of us, any of us that have presented to an ER, you have to go through that triage nurse, and that basically they're like the sentry, you know,
Mhm.
Gatekeeper.
they're the gatekeeper. If you don't say the right combination of words to that sentry, you're not going to get access to the area where you need to be to
Yes.
even start your treatment, whether you have to get the oxygen and the morphine and all these other things. That triage nurse is critically important to access. And so are there some things, some words, whatever that patients can use to help overcome that triage process to where they can get back quicker and start that treatment process?
Yeah, you have to be, which is sad because again, back to Dr. Elva Yumi's point, we're being tasked to be these super articulate, calm, and well-spoken people
Right.
at a time where our blood pressure is risen and our pain levels are risen, but we're being challenged to be like, oh, my name is Adrian Williams, and I'm experiencing sickle cell crisis, and now my pain levels are 6.5, but I anticipate it's going to be a 9.5 in about 3.5 hours. That's a lot to ask for a patient. So
Sure. Yeah.
Back to Dr. Elva Yumi's point is that relationship with that physician that you call prior to arrival,
Right.
that's key because now they're anticipating your arrival. Your doctor just called. I'm Adrian. My doctor called 30 minutes ago. My doctor spoke to X, Dr.
Right.
X, at this number. You should be anticipating my arrival. That doctor's already laid the groundwork for my arrival. So that's why everything comes back to that relationship,
Mhm.
and Without that
So
relationship,
it wasn't me that made the point. I want to make sure that we give credit where credit was due. It was Ms. Yvonne, and I read it, but that's exactly what I do. When anybody goes to the emergency department, I always call my patient, and the physician there. I'll call back the patient and say, I spoke to X doctor, ask for them by name. And then,
yes.
because that does make a difference. So I wanted to
And
just, please go ahead.
no, and that goes back to also, learning how to self triage, where when that pain level is in that 5-7 window, that's when you're making those calls. You're
Yeah.
not going to be conscious or cognizant enough to do that call when your pain level is at a 12. It's just
Absolutely
not going
not.
to happen. You're not going to be able to access the phone number. You're not going to be able to access the cell phone. It's
Right.
panic mode at that point. So
Right.
us being sort of cognizant of going, I've seen this before. I know what this pain level is, and I kind of know where it's going to go. Let's act now. So.
Mhm. Mhm. Well, it's like, if a woman is having a baby, right? When she is in full on labor and the baby is coming out, is not the time, to your point, to say, my name is so and so, this is what I'm feeling. We have a process, right?
Yeah.
But I love the sort of the key phrases that you're using that are so important. And I also think for any clinicians that might be listening, to help have that discussion with patients in the clinic and not in the emergency department. I want to just call out a few wonderful organizations and some people. There is the Sickle Cell Disease Association of America, which is established in 1973. And you actually had the pleasure and honor, we all did, to have the former president and CEO join us. Such a wonderful organization. They do a lot of good work, a lot of good information that's on their websites. But I want to remember somebody, and I want you to also remember somebody. But I'm going to start off with Ms. Bobby Ingram. I never met Bobby Ingram. She was a young lady who died, I think, at the age of 19 or 20. She was a journalism student. And because her father was an NFL football player, Bobby Ingram, her name was Bobby with an I, his is with a Y. When she was 8 years old in the hospital, she was getting great care, and she asked her parents. She said, "What about all the other kids that don't have a daddy who's an NFL football player?" 8 years old. She started her own foundation. And sadly, she died. Actually, her brother, who was playing on a football, he was in high school playing football and came home, and she had died. And so the whole school and the whole football team at Gonzaga High School in Washington, D.C., went to educate different groups of people in the city. So that's when we had this special panel, and we heard from her brother and her mother at that time. I mean, this had just happened just a few weeks ago. So imagine the courage that the family had to come and talk about their beloved daughter, this future journalist. And then the next time we had another event, then the dad, who was really having a hard time speaking about it in public, attended the event. So I just want to give mention this young lady, because she was really a truly advanced human being, I believe. I mean, a child who is dealing with anything, but especially with a chronic illness such as sickle cell, who at the age of 8 has the wherewithal to think of kids who may not be in her same situation. That is an advanced human. Yeah.
Yeah,
So
pretty
we
phenomenal.
just want to keep
Pretty
them in
special.
her family in our hearts. Bobby Ingram.
Absolutely. And it's that's amazing for an 8-year-old to have that kind of moral understanding, right, of privilege and lack of resources. And she said, okay, we have resources, but
Yes.
everybody doesn't live like us, and so what do they do? Another organization or group that I want to give a shout out to is the Third and Long Foundation, that is part of Santonio Holmes. Adrian knows him very well. We've done shows with him before, but I do want to give shout out to Santonio Holmes. And those who don't know who he is, he's a former NFL player. He was a Super Bowl MVP for the Steelers, when they won the Super Bowl, caught that beautiful pass in the back of the end zone. Probably one of the best passes in Super Bowl history. Being biased, yes, because I know him and I really do like him as a person. But he found out he had a child young when he was 17 years old and did not know he was a carrier of the trait. Did not know that his son's mother was a carrier, and while it's not a 1-to-1, so don't freak out. It's not a 1-to-1 if you're both carriers that you're going to have a child with sickle cell, but it does increase
the odds
significantly when both parents are carriers. And so their son had sickle cell. So imagine being 17 years old, being a parent, and now you're learning about sickle cell. And so, but he leveraged his celebrity as an NFL player to start the Third and Long Foundation because he wanted to try to help parents deal with, be able to be an advocate for their child, give them the resources, and whether it's financial or otherwise, to, be an advocate when they go into these crisis situations, be an advocate to seek a proper primary care physician for their child, and then help them build the tools, give them the tools that when they transition to adulthood, they are prepared to go out and live effectively, even without them, being there and teaching them. So when his son went off to college, he had to learn how, teach his friends how to be the good teammates for him. If he's in a situation, here's who you call, here's where you go. When he went to college, he had to establish a relationship with the local ER and say, hey, he went in before he had a pain crisis and introduced himself. Hey, I might be coming in, here's what I'm living with, blah, blah, blah. So to Adrian's point, if we can, there requires a level of organization that we have to learn very early in life. And the second thing is there requires a level of discipline and self-awareness. So when you know that pain is going up, you can't ignore it. And I know teenagers, that's hard, right? There's that frontal lobe deficiency that happens in teenagers that creates a problem. But if we can get on it early, then we'll have a better chance of living a very long and plentiful life if you build that team and have that self-awareness.
Yeah, I have to add to that.
And there are
those relationships you create when you're well are critical to your health and when you're not well. You can't speak well when you're not well. When you're in a crisis, you can't really articulate and you can't build relationships. You're in a panic mode and you just rot with pain and you're angry and you're frustrated and you're filled with anxiety. So as you said earlier, if I'm going to go to Miami for a month, if I just moved to Rockville or wherever I'm moving to, I'm going to choose a hospital. I'm going to choose a primary care physician, and I'm going to get an emergency room when I'm well. And I'm going to shake every hand in there. My name is Adrian. I'm a sickle cell patient. I may be here at some point in time. I won't appear like this. I'll be sweaty and I have a fever and my voice will be panty because my blood should be up. But this is how I'm treated and who I need to talk to build this relationship. So when you see me when I'm not well, I can be treated well. So that is a critical.
That's a very. You just made me think of something. Maybe a person.
That's a good line there.
A video of themselves that they could just show, of what they look like. But in all seriousness, in all seriousness, though. Sorry. In all seriousness, though, I do want to remember Miss Jennifer. Can you please tell us about her?
Oh my gosh. I met Jennifer at NIH the first time. She had written her book, Journey to Bethesda or The River in Bethesda, something like that, about her wellness journey and about her transplant. She had undergone a transplant and she was cured from sickle cell disease. And she was the most gentle, soft-spoken, warmest, like one-time meeting and you thought you knew her your whole life. And we had the best relationship. She invited me down. She was the president of the Richmond, not the Richmond, but the Virginia Sickle Cell Association. And she invited me down to speak. And she was just the one. Her family was warm. She was warm. And I discovered, I think a year ago, that she had passed. And my wife and I were just crushed. she was like just such a bright light. She was so gentle. She was so soft spoken. And even though she had undergone the transplant and was cured of sickle cell disease, she was still in the trenches and in the fight advocating for others. And she could have walked away and like, I'm good. I'm got my health now. I don't need to do this anymore.
Right.
But she was just as active as if she was suffering from a crisis. And she just inspired me to do what I do today. I can't thank her and her family enough. And I remember her so fondly. She was just the kindest person. And I pray for her and her family every day. And I miss her so much, you know. She was a bright light. And but that's what this disease does. It's insidious. That's why I'm out here fighting for patients. That's why I'm out here trying to lift this culture and educate this culture because I love it so much. And that's why I do what I do for people like Jennifer. She was just such a bright light of inspiration for me.
Well, Yvonne had a question as we're happening. And then after we answer Yvonne's question, Adrian, kind of as we're wrapping up here, let's kind of talk about what the treatment options are. How close are we to potentially a cure? And then what are the next steps for people living with sickle cell? So Yvonne, so some states test for sickle cell at birth. And so with children, and so you can get those records, you can get that what your status is, whether you're a carrier or have sickle cell, you can get that at birth. Now, in terms of people getting married, because you might not know that, your parents might not have that record. In terms of people getting married, yes, I would say definitely if you don't know your status, please get tested. And it doesn't mean that you shouldn't get married. It doesn't mean that if both of you are carriers that you shouldn't have children. Please don't take me wrong with that. But knowing can prepare you so if you do have children that increased risk of having sickle cell disease, you could be better prepared for when you do decide to have children. So you brought up a really great point. And there's so many testing agencies out there right now. I mean, you can walk into any LabCorp, they could check your local, primary care, emergency care can do a quick blood test on it, and you can find that information out very, very quickly.
Well, and when you go to the gynecologist, you can, as part of the prenatal testing, that's something that if it's not offered, you can ask for. So that's something else. I want to make one quick point because as a physician, I see this. Sometimes people who have sickle trait, or there's something called SC disease, may also have pain crises, and they get dismissed outright. Oh, you don't have sickle cell disease because it's not you don't have both of the gene
chromosomes.
Both chromosomes. So under the right conditions, people who have the trait can have a crisis. So what are the right circumstances? Well, when it's very, very hot and you're not hydrated, when the air quality is awful, when you're under emotional stress, when you have another illness. I've seen people who have had crises, and actually the person that I'm thinking of who's got SC disease had it in her eye. She lost part of the vision to her eye because there was the blood vessel, the blood cells were not right. So they caused a blockage in the blood vessel to her eye. So yes, the predominant people, the most of the time who will have crises are people with sickle cell disease, but sometimes having a trait, you can have these symptoms. So if you're having these symptoms, you should go to somebody and ask to be tested.
Absolutely.
And parents, please believe your child. If you don't know, please believe them when they start reporting how they're feeling. So, because a lot of times parents will just be dismissive of a child when they're reporting not feeling well, because remember, children don't have the full language to say. They say, I hurt, right?
I hurt.
And you've got to be, so believe them and don't just say, oh boy, get up, quit playing, let's not be dismissive. Please believe them.
Before we wrap up, I want to inject a little bit of positive energy into the discussion. I want patients and parents and caregivers to understand that there are support groups from California to New York, Alabama to Florida, thinking about you, caring about you, and reaching out to you that you can get in touch with. So I don't want this to be a very downtrodden sort of discussion about sickle cell disease, but I want you to know there are more subgroups now than ever. So if you do have a child or you do suffering from sickle cell disease, reach out to those support groups. They're filled with experienced people who walk that journey who can help you with your journey. And also, there are lots and lots of really fine physicians out there who are treating this disease. They're not all horrible people. They're not all racist people. But it's up to us to find them and create relationships with them. I really want you guys to know that the future looks bright, and we can do this together. And you can survive your disease and your family's disease or your family member's disease just as well as I have.
Oh, no.
And with a little bit of energy and with a little bit of goodwill. So didn't want to give people, I want to give people positive energy.
Yeah, let's give what's the latest on treatments? How close are we to an official cure for sickle cell? Anything that you can kind of give people some hope in terms of?
Well, they work on medications, but I tell you the one that's working in the biggest numbers is hydroxyurea. That's the one that's really, really working. When I talk to patients about that, it seems to be working for them, and when they can take it consistently, it has to be taken consistently. So reach out to your physician. There's two or three other drugs on the market that's working equally well, but I want you to be aggressive about talking to your physician about things that work, because a lot of patients are reticent about these therapeutics and about these medicines. And I really want you to get out there and do your own research, talk to your physician, and reach out and ask them what's working for other patients and can I try it? I've been on hydroxyurea for probably about 10 years now, and it's really working wonderfully for me. So ask your physician about that, and ask your physician about other drugs. But I really if I want to leave you with any message at all tonight, I want you to really create these relationships with your primary care physician and your hematologist oncologist. The key to your survival and the key to managing disease is building these great relationships with them and with the emergency room staff that you're consistently going to. I want you to stop going to 4 different emergency rooms when you're experiencing crisis, and I want you to choose one and build a relationship with that one. So when they see you, they recognize you, and they can treat you well, and you're not treated like a stranger. So,
thank you so much, Mr. Adrian Williams. That was terrific. And people who have any illness, any chronic illness, are human beings first and foremost that have that to deal with. Nobody's defined by their illness. So thank you for showing us and sharing with us your journey and all the tidbits. And did you put your information about your blog?
I'm going to put that in there now.
Okay.
Put that in there now. Yeah.
Over to you, Mr. Ellis.
Well, as we get Adrian's blog, I want to make sure that we put that on the screen. So drop that in the private chat as quickly as you can. I want to say, if you need more information, we have a wonderful on blackdoctor.org and on our website resource center there on sickle cell. There's a lot of articles in there as well. We've got videos that we've done. Adrian and I did 3 videos with Antonio Holmes last season. We did a Facebook Live with the American Red Cross, and we're doing this one here. And so this is the month. This is the month. I know I'm a fan of months, but not so much. Because people tend to forget, when it gets to the end of the month, they're like, it's over. No. People live with sickle cell disease every single day. But this is the month to educate yourself and to get involved. So if only 1 month out of the year you donate blood, this should be the month that you do.
This should be the month. And I want to say a special shout out to caregivers all over the country caring for sickle cell patients. You are my angels. You are doing the work. You are working harder than patients. I love you and I respect you. It's very, very difficult work, but don't give up on that person. Don't give up on that patient. Don't give up on that child. With your help, they can find a better pathway to wellness. So I just want to thank all my caregivers out there. You're doing amazing work, and it's appreciated.
Well, that's Adrian's site. So if you need any more, you see how fantastic he is. So I don't have to tell you all that. That's already been established in this program. But if you want to learn more about his journey and get that positive messaging for whether you're dealing with it or you're a caregiver. Please go to that site as well, thewellnessrevolutionnow.com. Please go to there and get all the information that you need for you and your loved one. So,
and if you write me, I will write you back. If you call me, I will call you back. I'm dedicated to helping patients and families everywhere. So
wow.
I'm not a loser. I'm
Thank
completely
you.
accessible.
Thank you. Thank you.
Thank you.
And thank you all for joining us here. Please share this program, get this information out. This is that month. And so again, please get this out, because we're all about saving lives here or making lives better. And this will help with that wellness journey. So until then, we'll see you next time on House Call with Dr. Gigi.